much, Mr. Chairman. Distinguished representatives of institutions, dear fellow representatives of civil society organizations from the world over present here, I would like to take this opportunity to truly and sincerely thank this august assembly, which enables us today to be able to make an appeal on behalf of civil society, sharing our experience in the field. I don't know if I have good or bad fortune to be representing civil society in general, and particularly African civil society. However, it is important that we focus on a certain number of items, of challenges focused on fieldwork. And we would like to express our appreciation, the appreciation of our co-representatives, national and international. My statement will be focused on the following points. First, I would really like to highlight how difficult it is to express the challenges we're facing in the various countries. A drug demand policy can only be effective if it is based on scientifically validated, reliable data. At this point, we can say that there is a lack in our various countries of this data, and we would like for this gap to be more or less filled in. Something else I really wanted to focus on is capacity building. And we would like the international community and member states to work on capacity building for health professionals and first responders, so that quality health services can be brought to bear, dealing with children and youth, and especially in educational circles, reducing risk in order to prevent HIV and viral infections from spreading among HIV drug users and injecting drug users is one of the things we're working on. We would also like for them to stop using drugs and to help them reintegrate into society, because we can't work on a reduction of demand, work on rehabilitation, and expect that to be successful if we can't propose that person, once they've stopped using drugs, to be able to propose them something so that they can be somewhat empowered and independent. And that's why we really want to focus on this social reintegration. This should be a priority in the context of combating drug abuse. Something else we really wanted to focus on is the stigma. That's something that drug users suffer today. We're not even talking about drug users, but even the family of drug users are victims of this stigma. Anyone who has any kind of close connection is victimized by these stigmas, because we don't take into account the human rights dimension. At this time, we must note that drug users are human beings, and they must be treated as such. They should not be stigmatized. They should benefit from all of the human rights as inscribed in the Convention on Human Rights. We also want to talk about cooperation. We want there to be South-South cooperation, which must be very well structured, because there are countries which are much more advanced than others in this context, and we think that this South-South cooperation should be developed. And North-South cooperation on the drug problem should also be developed up to a never-before-seen level. so that there can be multi-sectoral and multi-stakeholder exchanges on the drug problem in order to significantly reduce the gap between those who have made great progress in this area and those who are much less advanced in dealing with health and social problems at the level of drug demand. To conclude, Mr. Chairman, we would like to say that at this time, cannabis is one of the most consumed drugs in Africa. And it is associated with most of the mental health and social problems, even including internal displacement of families. So there needs to be something specific addressing cannabis use, since this is a great priority in our countries. Thank you.